Hello, and welcome to this presentation on reducing medication errors by the Marion County Rescue Squad, presented winter of 2017. Around 400,000 patients a year suffer injury or death from medication errors, costing the healthcare industry around $125 billion. A GEMS article from last year estimated that around 7,000 of these are pre-hospital based. Another study found that 10% of paramedics within a large agency had had a medication error, either reported or not reported, over the course of 1 year. So medication errors happen quite frequently. In perspective, 1,200 patients a day suffer from some type of medication error all across the country. 536 people died in the worst aircraft accident in U.S. history. So that would be like the worst plane crash ever, happening twice a day, every day of the year, which is pretty crazy if you think about it. In 2017, we had 3 reported medication errors here at Marion County Rescue Squad. Some were dosing related, some were medicine related, some were route related. We can do something very simple to eliminate medication errors completely. It's called a medication check, and we're going to go through that here today. We should be doing it every time we give a drug, even if it's something as simple as aspirin. For every patient that we're giving a drug to, every time we administer a drug. The sheet that's going to be on our ambulances looks like this here to the right. Medication check, right medication, right dose, right patient, right route, and right time. Are there any contraindications, and what is our desired dose, and what is our desired volume? This sheet is going to be on all of our ambulances here by the time you finish watching this presentation. Complacency really is what causes medication errors. So we're going to go down that checklist and we're going to check the medication every time. Look at the vial, look at the amount of medicine in the vial, look at the volume in the vial, decide what dose you're going to give, decide your volume, and check it out loud, even if it's just with the patient. You know, a lot of this is designed to do with your partner, but sometimes your partner's driving by the time you give a medication. So do it with the patient. Maybe they don't understand what you're doing, but you can talk it through with them, and that will get your mind right and checking this stuff every time. This all goes back to a concept known as crew resource management. They use it in the airline industry to prevent airline accidents. The pilot and the co-pilot say things out loud and check it with each other. They do it for even the simple stuff, like putting down the landing gear before they land, and they do it every time to make sure that they're operating safely. We can do the same thing with medication.
Sir, I'm going to give you some medication for your chest discomfort, but I'm going to confirm it with my partner before I give it to you, okay? All right. Med check.
Ready.
I want to give 75 micrograms of fentanyl IV slow push for his chest discomfort.
Are there any contraindications?
No, the patient vital signs are within normal limits and he has no medication allergies.
What's the volume?
The volume is 1 ml, and I'm giving 75 micrograms of fentanyl, and concentration is 50 micrograms per ml.
Angela, this is only 50 micrograms. We're supposed to be given 75 micrograms.
Okay.
So we're going to need to draw up another 0.5 mLs.
All right. Yes, this does say 50 micrograms per ml. That's my error. I'm going to draw up another 0.5 mLs for a total of 1.5 mLs. 1.5 mLs volume, 50 micrograms per ml for a total of 75 micrograms of fentanyl.
Okay, 1.5 mLs is 75 micrograms. I agree with that.
Okay.
Let's give it.
All right. So I'm going to give you your medication now. Sir, I'm going to give you some medication for your chest discomfort, but I'm going to verify that medication with my partner first, okay? All right, med check.
I'm ready.
I'm going to give him 75 micrograms of fentanyl IV, slow push.
Are there any contraindications?
No, the patient's vital signs are within normal limits, and he has no medication allergies.
What's the volume on that, Angela?
The volume I'm giving is 1.5 mLs, which has 75 micrograms of fentanyl. The concentration is 50 micrograms per ml.
I agree, and I see it's in date.
Okay. 75 micrograms of fentanyl, IV slow push, 1.5 mLs. Sir, I'm going to go ahead and give you your medication now.
After February 15, 2018, ALS providers will be able to access PICC lines for field use. PICC lines are peripherally inserted central catheters. Note the picture here where the PICC line is inserted through the saphenous vein in the arm and goes up into the vena cava. PICC lines may not be accessed for prophylactic IV access. They may only be accessed when the patient is in need of fluids or medication, as outlined in Section 2. In Section 3, you'll note these are situations when PICC lines may be accessed prior to attempting peripheral access in patients where peripheral IV access is doubtful. Contraindications to use are inability to aspirate or infuse through the catheter, and the catheter located in any place other than the patient's upper arm, as seen here in the picture.
I'm on the dry skin there and tried to wash it off as best I could today, but no problem. Sure they won't see that unless you got HD.
There we go. Yeah, we have HD. So this is a PICC line. There we go. Okay. So here we have the clamp. Okay, and here we have a one-way valve. Okay. So we swab the one-way valve just to clean it effectively. Okay. With the cleaning, it's more of a mechanical thing rather than the alcohol. The alcohol doesn't do a whole heck of a lot, if anything. So typically do this twice. And then, again, like the port, essentially it's a 10 ml syringe, okay, filled with normal saline. Okay, so Lurlock tip. So, and of course, opening the clamp. Okay, and first thing we do is advance it a little bit, and then we pull back, make sure we have blood draw back. Okay, if you want to see the blood flow, and then we have to prime it a few times. So back and forth, just cleaning the whole port, or sorry, PICC in this case. Back and forth, back and forth. And the reason why we're using a 10 ml syringe is because the pounds per square inch is sufficient enough that it won't damage the internal structure of the PICC. If we go with a smaller 5 ml syringe, it can damage the actual internal workings. Okay, great.
Some reminders for PICC line access. Always scrub the hub with alcohol. This is a central line, and it's very easy to introduce bacteria into the bloodstream with a central line. Never ever use anything smaller than a 10 cc syringe. If you use something smaller, the pounds per square inch of force could be enough to rupture the PICC line. You may not always get good blood return, but it should flush easily, so we never want to force a flush or a medication. If it doesn't flow easily, don't use it. So in review, make sure you use your medicine check sheet every time. The med check sheets are going to be located on every NARC bag and every drug bag in our ambulances. Keep your mind on task. Complacency in the back of the ambulance is a good way to result in errors. If you have any ideas on how to improve our program for medication compliance and reducing medication errors, please come see me. Thanks and have a great day.